Hello, and welcome to my page where we discuss everything occupational therapy and sexuality related. My name is Rashmi Reggie, and I am currently an occupational therapy doctorate student who is doing her capstone on addressing healthcare professionals' lack of competency and confidence when addressing sexuality with the geriatric population facing fatiguing conditions. Though my page is catered towards occupational therapy, I do welcome all healthcare professionals to come and learn about sexuality with me. Let's dive right in. Sex. Now, this word tends to make a lot of people uncomfortable. And my goal through this program and even through educating healthcare professionals is so you guys can get through that feeling of being uncomfortable so you can finally have discussions and talk about the sensitive topic with your clients. Sex, it is an ADL, and it plays an essential role in an individual's life. I kind of want to start by breaking down the difference between sexuality and sexual activity, where sexuality can be defined by AOTA as a state of mind representing how an individual feels about themselves, how they view themselves, their relation to their own gender, as well as the opposite, how they form relationships, and even self expression. Whereas sexual activity is defined as engaging in activities that result in sexual satisfaction. There is this big misconception when it comes to the elderly population, and that is that there is a lack of interest in engaging in sexual activity. However, this could not be further from the truth. Age and gender does not suddenly mean an individual's sex drive just suddenly decreases. Usually, it's due to an underlying condition that's associated with this. So, for my program specifically, like I mentioned earlier, I was looking at fatiguing conditions like cardiovascular conditions or COPD. People usually deter away from participating in sexual activity due to either physical, mental, or emotional blockades following one of these conditions. The geriatric population views engaging in intimacy with their partner as a vital component to an excellent quality of life. And research has also demonstrated that a lack of expressing sexuality or sexual participation can actually cause a decrease in quality of life and self esteem. So you guys may be asking, Rashma, what is the problem? Or why do you have an entire program on this? And that is because there's a huge gap of information on how to address concerns of intimacy with this population. There's that lack of competency and confidence with healthcare professionals on how to address intimacy and sex. As I mentioned earlier, sex is an ADL, and all healthcare professionals should be educated on how to address this concerns with patients. However, I am going to give a little bit of heat to my OTs out there. It is within OT's scope of practice to help individuals to safely participate in this occupation. There is that lack of initiative from OTs or even all these other healthcare professionals to address this topic. And that's because it's due to being such a sensitive topic or having that lack of confidence. And remember, that lack of confidence usually kind of derives from that lack of competency, which is why I always encourage all healthcare professionals to educate themselves on this topic or have resources ready to go that when a client brings up this topic, you're not shying away. It can be concluded from all the literature reviews that I have done that an essential barrier for patients to partake in sexual activity it is due to a healthcare professional's lack of proficiency and confidence to address these concerns. Research has also shown that the elderly is more willing to have these questions answered by healthcare providers who have the knowledge and confidence on the topic. So addressing this problem can help the geriatric population with these underlying conditions to finally be able to partake in this occupation. So my question for you guys is, would you as a healthcare professional or even a future healthcare professional let a patient continue not to partake in intimacy or sexual activity and end up having them report a decreased quality of life, loss of sense of self, feeling like an inadequate partner, all because you as a healthcare professional felt uncomfortable to discuss this topic? As I alluded to earlier, from what I gathered, I feel like a healthcare professional's knowledge and confidence on this matter has a direct relation to the population being able to partake in this occupation. And it being such a sensitive topic, this population really looks up to their healthcare professionals to help them address this concern. I do expect people to feel uncomfortable, But I'm really hoping this program helps healthcare professionals get through being uncomfortable so they can finally feel proficient and confident enough to help address this sensitive topic. Overall, helping this population improve their quality of life by engaging in an occupation that they no longer thought they could.